And it is a Tuesday, and you know what that means. Your HealthCare Partners. It's a feature that we bring to you, brought to you by GRMC, where patients are partners. And we welcome into the studio two of our subjects today. Is this an uncomfortable place for you, Doctor?
No.
Okay.
No.
That I take great delight in opening the door and saying, "Doctor, come in, please." And the later I do that, the better satisfying that is. I'm kidding. People say that. Make them wait. And then go out there like 20 minutes later and say, "Oh, you're here."
Trick or treat.
Trick or treat. Dr. Eric Spak from the Guam Regional Medical City. He's a diagnostic radiologist, and he's joined by Sarah Alejandro, and she is a mammography technologist. Good morning and welcome.
Morning.
Welcome to the studios, and thank you for taking off. Is it a busy day for you generally?
We're quite busy. The hospital has definitely increased the number of patients that are coming there, and people in the community have recognized the quality of healthcare there, so it's quite popular and usually quite busy.
Yeah, it is. And about this time of month as well, October being Breast Cancer Awareness Month, there isn't a medium that you don't find some kind of literature or some kind of plea, and it almost sounds that way, for women to come in and get checked. They even have incentive programs for women to come in and get checked. You talk about this being being preventative. This is prevented. This is a procedure that a woman can have that will detect cancer.
Right. Yeah. The mammography is still the best screening tool for detecting breast cancer, and it has reduced mortality in the U.S. by 20 to 30%. So it's definitely making an impact. And the idea is to catch breast cancers early when they're more easily treated and not wait until the cancer is spread throughout the body, which makes the treatment much more difficult. So the idea is catch it early, and mammography is best at picking up those small, tiny calcifications that are about the size of a grain of sand. And other tests that we do, ultrasound and MRI tests, can't detect those small particles of calcification, which is a sign of breast cancer. So mammography is still proven to be the best, most accurate way of screening women for breast cancer.
And I was mentioning it last week to Dr. Hill that how grateful women are that the technology has advanced so much that it isn't the nightmare that it used to be. I'm sure, Sarah, you could speak to that. Women who haven't had one in a long time have only heard the horror stories about the old machines that used to be they used to have back in the day. I mean, as early as I want to say in the 1990s, that the technology has changed quite a bit.
Yes. Right now we're using the full-field digital mammography at GRMC.
Yeah, and you don't have those big steel sort of clamps, and that heavy machinery was pretty intimidating.
No, we don't use that anymore.
Yeah, and now it's what is it fiberglass, or is it what is it?
It's kind of plastic, and it's digital, and our machine at GRMC has a sensor that very it's not as painful as it is like the other facility, but this machine is really comfortable for women. That's what most of my patients will tell me.
There was this I don't know if it was a secret, but women would talk about their experiences getting a mammogram, and they would talk about the differences in the size of the breast and whether or not, back in this, I'm talking about this before with the older technology, and maybe does it apply now? Does it matter the size of the breast to determine the uncomfortability rate, or does it matter at all?
Maybe not. Maybe the smallest is kind of hard to, the breast, the smallest breast is very hard to put in the machine.
Right.
But some women who are bigger breasts too, is like they will say that it's, actually maybe the smallest. It's
The
very
smaller
hard.
would seem to me to be
maybe
harder
it's
to.
very hard to put it there.
Yeah, right.
Yeah.
And the larger breast they say would hurt
Easy.
more, but it easily
Easy
fits.
to put it there.
Yeah, it's easy to put it there. Sure.
Yeah.
Dr. Spak, could you tell me, when, from the moment that a woman has been diagnosed, what is your role in that whole process after they've had a mammogram that suspects there is something?
Yeah, well, the nice thing with our hospital is we also have kind of a one-stop shopping. You've probably heard from Dr. Hill, Dr. Coe, that right within 50 feet in the same area of the hospital, close to the back entrance, we even have a private entrance there for patients. We have the imaging area, radiology, where we do the mammograms, breast ultrasound, MRI. The radiologist reads the mammograms, looks at the pictures, and decides if there's something worrisome that might need a biopsy or might need a referral to one of the surgeons. And as far as treatment, if we do find a breast cancer, we have an imaging site an infusion area across the hall in medical oncology, so they can give the chemotherapy right there, the intravenous chemotherapy. We have surgeons who can put in chemotherapy ports that make it a lot more comfortable to get your chemotherapy. And across the hall, Dr. Coe has the radiation oncology, because most of the breast cancers that are treated require radiation to prevent them from coming back later. Mm-hmm. So everything is right there. And as far as reading the mammograms, we look at the mammogram. If we see something suspicious, and it's new, it's definitely important to bring in your prior mammograms to your appointment, because it's changes in the breast that we look for. If there's no change, there's probably no cancer. But if we notice a change, new calcification, say, or a new small lump or density on the mammogram, we may need to do a biopsy. And it sounds scary, but we use a needle to do it. It's not like the old days where you had to go to the operating room, have a surgery to remove a lump. We can sample the small part of the lump with a needle, so it's almost painless doing it. Mm-hmm. And then from there, we decide if there's a cancer, whether you need surgery or chemotherapy or radiation therapy. So it's all right there.
What the course of the treatment is all in one place. Listen, I don't mean to interrupt right now, but I do have to go real quickly to the Guam Power Authority, because we got a power update from Art Perez. Good morning, Art. How are you?
Good morning, Patty.
Hi.
Just been a busy morning.
Yes, it is, I'm sure. Tell me what you need to tell me.
Yes, we have some what we call intermittent outages ongoing in the area of Tamuni. This is by Payless, Jonestown area, going all the way out towards GPO. Power has been going on and off about last count about 4 times. We do have a line crew in the area. It will go out, and we will try and test close it, and it will either hold or it will still go out again. But we do have a crew in the area removing debris off lines. The wind conditions have picked up as of late. We still have a crew down south on the Agate Yamatic Road, still doing some vegetation clearing. Work in the Baza Gardens and Windward Hills area has been done. However, we're still working our way down the other side of Talafofo down to Narahan, and some areas up north that are still pocket outages that we're responding to, and some areas in Laddie Heights area with transformer problems that crews have been dispatched to go and see what the problem is.
We got
the things we have right now.
All right, we got Teads, we also got DMV saying that they're intermittent as well.
Yeah, that's correct. And Teads related to an outage that we have ongoing in Barragata that crews are still trying to clear vegetation offline.
Okay, I got word from the University of Guam as well. You have anything out in Manila?
I don't have that on my radar right now, Patty. I'm sure it's been reported to our dispatchers already, because they're dispatching the crews that as soon as they're finished work in one area, they're dispatched to another, so they're going around the island. And that's why I mentioned this morning with Rick, if they see our line crews with the yellow lights flashing on the roadways, please give them a white burst to allow them to be dispatched and get on site to these areas that need to have.
Okay. All right. I think power is the issue of the day, Art, so you can drop in anytime. We'll be happy to take your call.
And thank you very much for allowing me to get on the air, Pat.
Absolutely. It's my pleasure. Thank you very much for the service. 10:47, and we are still in the studio this morning with our partners, GRMC, Dr. Eric Spak, and Sarah Alejandro from the Guam Regional Medical City. What's the timing like? I think that probably one of the most the uncomfortable moments is after the mammogram has been done and you've got whatever, you walk out the door and take it to you. What's that time difference where a woman is waiting for some sort of sign of?
Well, we look at the mammograms usually the same day and come up with a report that we'll send to the patient's doctor. If the radiologist or if the technologist sees something obvious on the mammogram, she'll call the radiologist into the room to take a look and decide whether they need to do additional images there. Sometimes we'll do a magnified view and focus on that one suspicious spot, and we can take care of everything all at the same time. But usually patients will get referred to their doctor pretty quickly. They can usually get the result. The doctor can get the result within a day or two, so it doesn't take very long. And if we do a biopsy, it's usually less than a week to get the result back, if it's a benign process or if there's a cancer that needs treatment. So it can be done pretty quickly. And women come in all the time with small lumps that we find on an ultrasound. And sometimes we have a choice. If it isn't a particularly worrisome lump, then we might say you can come back in 6 months and check for any changes, or you can get a biopsy with a needle. Many women, they want to be able to sleep at night.
Sure.
You can do a biopsy and you'll know quickly that it's nothing to worry about, because 80 to 90% are nothing to worry about. They're just benign.
Yeah. What are the odds that you would be sent away and then called back that there would be something suspicious? Does that happen, or is the equipment so exact that that's not likely?
It can be up to 20% where women will be called back and say, we need some additional focused, magnified views of a suspicious spot. So maybe up to 20% will be called back to get an additional view.
Yeah. Well, you know what, in the conversations that we've had in October alone about breast cancer, all of the doctors so far have concurred that the situation in Guam seems to be much more of a serious situation than they had experienced in other hospitals. But there's certainly something about Guam. I think that you've been here longer than the other doctors. What are your suspicions?
Well, both of us, Sarah and myself, are part of the Cancer Coalition. So, we've talked to Dr. David, Annette David, the epidemiologist here who tracks this. And actually, there is no increased incidence of breast cancer in women here versus the U.S. It's basically the same. Actually, they've said slightly less, but basically the same. So I don't think there's any more risk of getting breast cancer here. It just seems like patients sometimes don't realize that they have something that really needs to be looked at. And so they'll come to see their doctor very late. They've got, instead of having a lump that's, a ½ inch in size, it's 3 inches in size. By that time, it may be very hard to treat. So women need to know that, especially with our new Siemens machine, the patients have told Sarah, it used to be painful. I hated coming for my mammogram. The sensor on this machine will detect how much pressure, and it'll put the minimum pressure necessary to get a good picture. And patients have said, I'm going to tell my friends to go there because it's a big difference, and it really isn't painful with our machine.
Those heavy steel plates is what they were, and they sort of clamp you. I don't think it made a difference what size your breast was. I mean, the fact that they were grating it right up against your chest, and it was enough to say, you know what, I don't think I want to do this once a year. There still is the encouragement for women to get a mammogram once a year. Is there encouragement to do this if it's more likely in your DNA, for example? Do you have these other contributing factors?
Right. I mean, if someone in your family, your mom, your sister, one of your aunts, your daughter develops breast cancer before menopause, like in their 30s, then the recommendation is you're at a higher risk for having breast cancer, up to 13 times higher if you have several relatives who have breast cancer, close relatives. Then we recommend starting screening 10 years before your mom or sister developed her cancer. So down to age 30, we'll start screening people even earlier. And if the risk is extremely high, we may also recommend getting an MRI as well every year, because MRI can detect some things that the mammogram doesn't detect. So occasional women will require screening. And we do have a calculation of how high your risk is and we can tell whether you need to have the MRI or whether it's recommended for screening also.
Well, the benefits of going to GRMC, like you point out, Dr. Spak, is the fact that it's all on the same floor. The doctors all within feet of each other. So you're not running around to different parts of the island. You certainly aren't running around all over the hospital to see the next person.
Right.
In the end.
Right. The experts are right next to each other. We consult with each other every day. You know, Dr. Coe will walk over and want to look at one of our CAT scans or mammograms and decide how to do his treatment. So it's very convenient, makes the treatments more accurate.
Certainly more efficient.
Right.
The communication is right next door. That certainly is beneficial to the patient. How long have you been here, Sarah?
Oh, I've been here since 1990.
Oh, okay. You've been here for longer than I have. Okay. And Dr. Spak, you've been here for a while as well.
Yeah, I've been here 12 years, but Sarah actually is the one who set up the PMC clinic program and got the first certification for mammography from the FDA 25 years ago. So
wow.
She's the first
She's
one.
the top of her game then, huh? And she's very humble about it. You could tell, probably a little bit shy about it. Well, I certainly appreciate all of the information that we can get, especially on this issue at this time of the year, October being Breast Cancer Awareness Month. There's a lot of information out there. If you're not getting the information and you're hearing the sound of these doctors and technologists that come into the studio, go fish it out. I mean, you don't need to go very far to get information that could be valuable to save your life or at least educate your children about this terrible disease. I really appreciate you coming. It's so good to have met you.
Yeah.
Sarah, thank you so much.
And if people need more incentive, the United Airlines has provided a couple tickets flying throughout Asia in a raffle that's held before the end of the year. So there's another incentive to get your mammogram now.
Let's get this. You go and get a mammogram, and your name goes into a pot, and then there's a drawing later for you to go anywhere in this area where United flies. Well, I think that's incentive, and especially because it's not going to hurt. That's the best part. I appreciate it. Thank you so much for the time. Charlie, thanks for hooking this one up. Every Tuesday at this time, your healthcare partners brought to you by GRMC, where patients are partners.